We try to focus on using family members of our patient base and the community, the renal community, to be part of our employees so that they stay connected. And what I do personally is I try to treat patients as though they were my family, as though they were somebody I care deeply about. And in saying that, what does that mean? That means I give every one of my patients my cell phone number, and our technical department gives them 24/7 access to somebody. Our nurses are available 24/7. So you have a doctor, a nurse, and a clinical technical backup that's always available to you. What does that mean? Well, I think that means we're providing concierge service. We are providing customized service to you, and we provide care at home in a way that other facilities don't, that are restrained by corporate edicts. We will send nurses to the home much more often, technical people out to the house much more often than, for example, the big companies would. They would be limiting their nurses' activity outside the center, the miles, and worrying about liability. We only care about what's best for our patients. So over the years, we've distinguished ourselves because we have extremely good transplant rates. Our patients get transplanted frequently. We have good relationships with all the major transplant centers in California, but importantly, we utilize out-of-state centers to expedite transplant process. So we're worried about your overall health, your life as a patient. We want to walk you through and make it easiest for you. The other thing that's distinguishing our facility is we have extremely low hospitalization rates. That speaks to the quality of the care that we provide, that our patients don't end up in the hospital. They get transplanted though. So our quality is one that is driven by the fact that our nurses are experienced, and I myself have been focused on home dialysis for a long time, before home dialysis was popular. And the reason I say that is because home dialysis was the one way that I could provide better control of the one factor that I believe that wasn't being addressed in conventional dialysis, which is that we don't control fluid very well. The one solution to this is more frequent treatment, and to do treatment more frequently, it really is calling for us to do this at home on a schedule that you can determine, and on a schedule that's not going to impede the rest of your life. That's what our program's about, is customizing our care so that you can get the most out of your life and have dialysis not be an impediment to your going on and doing the things you want. Also to facilitating you to get off dialysis and get you transplanted. Now, what does all this mean? This means that we are a concierge center, and one of the things we can provide is customized care in the home setting on your schedule. If you need help and you want to have an assisted home, that might be something your insurance might cover if you have a PPO plan, but in general, that would be something that is not paid for by Medicare. It's something, though, that is available for those who can afford it, and in those circumstances, we can tailor the amount of assist to being appropriate to the level of acuity of the patient. In other words, a sick patient who really needs a nurse there every time, I could do that. And a patient who would get by just with a patient care technician, that's the usual circumstance. We would provide that. In any case, part of our service is to do your labs at home and to have a physician available for televisits at all times. And for patients who want to maintain their relationship with their nephrologist, we make it easy for their nephrologist to become part of our staff and to continue their relationship. And if they don't have a nephrologist they feel is well-versed in home therapies, I would be their nephrologist. And our goal is to provide the best care. The sign on the wall here says better quality of life and freedom through customized home dialysis treatments. And that is really the philosophy we have. And I try to do that in my world as though our patients were our family. And we try to actually use family to take care of our patients.